How have you been?
She can't hear you real well from the back of the room.
Hello.
But
Hey, Tim, how you doing?
I'm good. How are you?
Great, thank you.
but he can hear you, which is good. That means the sound is going to pick up just fine when we're up here speaking.
I was looking forward to hanging out with you, sir.
Yeah, I'm sorry, it's not gonna, well, I'm not gonna make it down there, but next time, you're in good hands with Jeff and Anthony.
You know why, right?
More babies?
Yeah, he had another baby 2 weeks ago.
Good man.
Anybody else in the room?
Yes, we have an entire well care crew here,
Oh, excellent.
but again, because my camera's not working, I can't show you.
You can, like if Jeff calls in on his phone, you could probably put it in the other direction so you could see a little bit more there. But or your phone it would work perfectly fine, but no issue. All right, we'll see. Well, let me know. I'll be here, so if you need anything.
Okay. I'm going to mute it. Thanks.
Appreciate it.
Guys, we need just about 2, 3, 4 minutes till we get started. So just hang tight. So we got 8 people on. Sure. You gotta go. Make a left at the elevators, go down, make a right.
So it's quicker for me to go on.
No, it's actually not like, maybe. Who's staying?
I'm staying in Lexington.
You guys, you said. Okay, see, that's, you just find that out?
No,
Oh,
Yeah.
Okay, got it. You guys.
oh, well, I'm not,
You're going. Just
I live here.
you're going.
I'm here,
You're here. You live here.
Right. I'm
In
homeless.
Louisville, as they say.
Yeah.
Wow, but she's also in Ohio.
Louisville.
Yeah, I kind of live in both. I don't have a home anywhere now. I've got boxes in my car, where I live, I'm homeless, I'm nowhere. I'm taking stuff to my daughter's house, and she's like, no, you need to quit that. I wanted anywhere.
So you're moving around. You're moving around. It's like when people come to New Jersey, they say Newark. Instead of
Yeah.
Newark, it's Newark.
Look,
Newark.
I stayed there one time for 2 months in the summer. I was like 13.
Oh, okay. So good. So you don't remember
But I stayed, we were like right by the ocean. Somewhere, not far from the ocean. In New Jersey.
Oh, but it wasn't Newark then.
Well, I don't
You
know.
were- you were-
no, it was not.
Well, we flew into Newark, I think.
Right.
But my uncle, he was in horse racing, he was a horse trainer.
Okay.
So we were right there for whatever that racetrack was.
That one is, yeah. Okay. We'll probably in Hudson County somewhere. All right, we're gonna wait for Kim.
My brother-in-law was born and raised in Trenton.
In Trenton,
Yes.
okay. That's too bad.
Yeah. He left and never went back. Yeah.
We'll just wait for Kim to come back and change.
I had some good summers there.
In Trenton?
Yeah.
Really?
What weather, you know?
Yeah.
Yeah.
It's not the,
My parents put me on an airplane and they went on to Trenton and they went on vacation.
we're smart.
Yeah. Who does that to their child?
I was 13. Especially when Chinese food, we got to go to New York and go to Macy's.
They put me on a plane out of one stand by and said, you'll be all right. And left the country.
Oh, really?
They left the country. I said, you come to your sister, she'll be fine. I think 12, 13.
All right. All right, we're gonna get started because we're our intention is to try to do everything within 2 hours or less. That's our goal here. So hello, everyone. Thank you for coming. Thank you for being here. Hello, everyone on Zoom. Looks like we got about 8 people on Zoom right now.
How we doing, everybody?
Hey, Ant.
So those of you that are on Zoom, you may have seen part of what it is that we're going to do in the beginning yesterday. So just kind of bear with us for 10, 15 minutes while we kind of run through that portion of it. And then we have a slew of WellCare people here. I know you guys can't see them. There's got to be, I don't know, 18, 19 people from WellCare sitting in the room right now. But again, I realize you can't see them, but they're here. Just trust us. We're going to roll through Kentucky and Ohio. That's the goal, is to go through all the product there and kind of do a deep dive into it instead of the overview of which we did on the national rollout. But wanted to hit a couple of things first as far as you just getting ready for AEP. And I know some of this stuff you should know already, but we kind of forget it. And as we get into open enrollment, we have to have kind of a well-oiled machine as far as everything working right. For example, know how many days it is a week that you're going to be working, know how many of those 7 weeks in AEP that it is you're going to be working, come up with a plan, have that put together, make it so that you can get us schedules on a very regular basis. The worst thing in the world is us trying to chase you on a Friday afternoon for a schedule for appointments on Monday. We're trying to book those appointments for you. So do everything that you could to make sure that you're getting those schedules in. You can get those schedules into Jeff, you can get schedules into Jeanette, but just make sure you get those schedules in. The products for each state, specifically, we're talking about Kentucky and Ohio today. Do any of you guys work outside of Kentucky and Ohio? What's that? Where else are you working?
Tennessee,
Tennessee.
some a little bit of
All right, well, we'll have to figure out how to get a deep dive for you on those two states specifically, as well. Okay. Obviously, as far as your presentation goes, now you're doing it in the field and over the phone, correct?
no, so
Just over the phone, strictly, okay? And you're strictly over the phone if you're in the field. Okay. We've got a little bit of
are you talking about the states or just?
in general.
Yeah, in the field.
In Kentucky, you're doing it. Right, okay, all right, got it. I'm thinking, Kim, that you guys are probably gonna go into the changes as far as the network goes, as far as addition of doctors, so on and so forth. It is my understanding, and I haven't seen it yet, but it's my understanding that you are going to be able to check doctors that will tell you the different plans that Dr. Smith takes, and not just have to go to Allwell or just have to go to WellCare, that you're gonna be able to actually see. Dr. Smith takes Allwell, Dr. Smith takes WellCare. It should make things a little bit easier for you. One of the things that's coming up on a very regular basis is specialists are not being checked. So make sure you're also checking the specialists for everything. God, I wish James was sitting there. Make sure that you're checking the specialists as well as the primary care physicians. Obviously, check all the medications. One of the big things that we have to bring up and mention is, even though a huge majority of the leads you're working are WellCare PDP leads, it doesn't mean that you don't have to check the formulary. You have to make sure you check the formulary, because there could have been a change in the formulary. It could be a different formulary. It could be that the person got an exception for the drug that they're currently taking right now, and doesn't necessarily mean it's covered yet when they go into the hearing. So make sure you're checking everything. When you're doing it over the phone, make sure you're asking all of the questions. We don't need anybody coming back and asking for a recording. Find out that you skipped certain questions. Unfortunately, that's when we're going to find out, is when there's complaints. Questions were skipped, so make sure you're asking everything. Make sure if you're doing it over the phone, you're doing all the disclosures. Make sure if you are doing it over the phone, you get the words "I agree" at the signature part. It's a big problem when people say, and we accept that as the yes, and it's not technically their signature. That I agree is their actual signature. So make sure you're getting that I agree. Notes and applications. Any notes you have on a client, we're doing the work for you by storing all of your notes. You're supposed to retain all records for 10 years. We're doing the work for you by retaining, but you got to get them to us in order for us to retain. Whenever there's any sort of complaint at all, and we go back and for argument's sake, let's say they say they didn't check this doctor, but you have the doctor written down, or you have all the doctors written down, and that doctor wasn't one of the doctors that the client gave you. You have your notes to say, yes, when I spoke to Mrs. Jones, she gave me these 3 doctors, but she never told me about that doctor. So I know we all make notes and we scribble them on Post-its or whatever it might be, but let's face it, they end up in the garbage. If you send those over to us, we're storing them with the application for you. So if there's ever an issue, we can go back and say, here's your notes on it, and you can answer compliance the proper way. As far as Ascend goes, at this point, does everyone feel like they're using Ascend efficiently? Are they getting stuck at anything? Feel pretty good with it? You're doing your homework to Ascend as well?
I haven't used it.
Definitely Ascend, okay.
That's one of my questions, because I got to send that in to you, or how does that work?
So, great question. So when you use Ascend, you're getting a PDF of all their information on it. Just print a PDF on it and email it to Jeanette. And we save all that, and it has everything on it that we possibly need. If you're not using Ascend now, you're missing out.
I know I'm going to use it this year.
Okay. I don't know if today is the day for it, but if you need a little tutorial on the Ascend side, either Jeanette in our office could do it, Kim could do it, us could do it, but we definitely, you gotta start.
We also have a video online, the div.com/Centene, where Jeanette goes through it as like a Zoom video. You can watch that at any time at your leisure, the div.com/Centene.
Okay, so the div.com/Centene. We have all sorts of resources on that website. One of the things we have on there is a video of us going through how to actually use the Centene. Mike, specifically to that page, is there anything else that I should hit?
We've been updating it as we, today, just trying to get some of the videos up there that we've been making. So yesterday's videos up there talking about New York, New Jersey, Connecticut. We put a new Centene update in terms of content. We have our back to school meeting from yesterday. Some of the updated state information. There's not a tremendous amount of content there right now, but we're populating it as we speak. So you'll keep
And
checking.
all of that is on the /Centene one, correct?
Yes.
Okay.
Telesales as well. Telesales has other stuff that you might have of interest. But for the most part, Centene is the one that is speaking directly to what you're talking about.
Okay, so from a resource perspective, since it came up, it's the div.com/Centene or /telesales. Both of those pages have different resources for you. Our script is up there, everything. There's an abundance of stuff up there that you can find useful. Some stuff you're gonna say, hey, this isn't useful for me, but other stuff is. We have a lot of the one-page flyers up there that talk about the ancillary benefits for the Centene product, which again will get updated with the 2022 stuff. One of the things that we recommend big time is the states that you are going to be doing business in. In order to get access into Ascend within the states that you may get a license really quickly in that state, doesn't necessarily mean that you have access to Ascend really quickly. Let me real quick explain the process of Rollout. You get a license in the state, even though that state says you're good and you have that license, until NIPR tells WellCare that you have that state, WellCare does not know that you're licensed in that state. Every single night, WellCare pulls a record from NIPR. If NIPR is not updated, WellCare doesn't know that you just got an Ohio license for it. After WellCare knows that you have a license, that night, Ascend runs and gets you access into Ascend. So nothing happens like this. It's not a phone call where we say, we get you access into Ascend in the next hour. So what we recommend doing is going into Ascend for every state you plan on doing business in and trying to do an application in that state to make sure it actually works for you. Because you don't want to find out once you're either sitting with someone or you're on the phone with someone. Because if you find that it's not working for you, it's not going to get fixed that day. It's going to take a day, 2 weeks, or 3 days. Okay. And then the last thing I want to hit is I want to talk a little bit about HRAs. Who's doing HRAs? Are you guys doing them on the calls all the time or sometimes? Sometimes. Same?
No, all the time.
All the time.
It's
How
too
about you?
easy.
I did it once. But
Perfect. Perfect. Jump ahead to this. So, since January 1st, we have done 2,200 HRAs. Right? You could do an HRA 3 different ways. You can do it immediately, you can do it scheduled, you can do it call line. We recommend doing it immediately. It takes 5 to 7 minutes to get it done. It's not that big of a deal. A lot of times people are skipping the HRAs, but honestly, because they're scared. They're scared. They either don't want to waste the 5 to 7 minutes, or they're scared that people are going to maybe cancel, maybe not want to give them the information, maybe give an objection, maybe. Hello, sir. No, we saved you a seat right in the front row.
oh, you're at the front row, okay.
How often are you doing HRAs?
Say that again.
How often are you doing HRAs?
Pretty much every time.
Pretty much every time. Perfect.
Yes.
Perfect. So here's the deal. Those little bonuses that are being paid on the HRA side, we've paid out over $88,000 this year. It's just extra money on client you already have by literally just spending a few minutes. To break it down, Dan put together some analysis of comparing agent A with agent B, and we won't give any names, but some of you actually might be agent A or agent B that are sitting in the room right now. Agent A had over 300 apps. 10% of the time they did an HRA. They made a $1,230 bonus. Agent B did 50 apps less than agent A. 90% of the time did it, made $14,700. That's a huge difference from spending a few more minutes in just asking some questions. Andrew, get ready because I'm going to be coming to you in a second. Here, agent A did 213 apps. 92% of the time, they made $6,300. Agent B did more apps than agent A, but made $360. It's just downright silly not to do the HRA. The last example. These two agents did just about the same amount of business. This person never bothered, made zero. This person, 83% of the time, made $7,400. If you guys think about the amount of apps you're going to write for 8-bit, put the amount of time that you're going to spend on that HRA, calculate it out, you're making a lot of money for that 7 minutes time it takes to do the HRA. It makes no sense not to do it. Andrew, are you there?
Yes, sir.
Okay, we're gonna do our best, and it's not easy to hear for everybody to hear you in the room. But can you just kind of what you did yesterday? Can you just say exactly how it is that you roll into the HRA?
Yep. So I'll say, all right, Mr. Smith. At this point, what we like to do with all our members in order to get our health care off on the right foot with WellCare, we do a quick HRA. It's a quick way for us to gather information on our members with the sole purpose of being able to create and improve on our benefits every year. And it really does help us do so. So I'm just going to ask you a couple of health questions. You answer with a yes or no if you have any. Do you have COPD? Blank, blank, and I just roll into it just like that. There's not even a question of do you want to do it? It's just bop, bop, right into it.
Thanks, bud. So the purpose there is we're not asking people if they want to do the HRA. We just do it. We just jump into it and we just do it. Why are we doing HRAs? What is the benefit of doing HRA? People could start getting immediate access to some of the things they need right away. If they're going to qualify for some sort of chronic care specialty item, we're going to know it right away. Case managers start getting assigned right away. It makes it a real product that they start getting benefits on right away. So to skip it and to skip out on the amount of money that you could be making on doing it, it doesn't make any sense. Dan, anything that you want to add to that?
No, I think you covered it really well. You know, the way we always broke it down really quick. Just those three people got over 25% of it. If you were to grab 25% of what we paid next year, you're one of the three people. If you grab 10% of what we do next year, whatever it may be, could be a house. It could be a down payment for a house. It could be a vacation with your family. It could be a new car. It could be a renovation to your basement. It could be something that, you know, could be a big, large payment in the big scheme of things that could help anybody, help your family and grow, what have you. So definitely don't leave money on the table there.
Cool. Thank you. Okay, those of you on Zoom, I'm sorry if you heard again what you heard yesterday, but we are going to go over to the purpose of why we are together today. Kim, give me a second. So Kim, are you going to start?
I'm going to introduce the team and then turn it over to the team.
Okay, so let me just bring up the presentation. So as you guys, a lot of you already know, Kentucky is probably one of our, not probably, it's definitely one of our favorite states. You know, it's kind of tight on whether you got the #1 state or not, but it's really, really, really close. Okay, she's our favorite state. So we have a fantastic relationship with Kim, obviously. And we've done pretty well in Kentucky, and we're going to continue to do well in Kentucky. There's a bunch of people on the phone because they enjoy writing in Kentucky as well. We anticipate a lot of leads here for this year. We know that sometimes leads can be a struggle. We anticipate a lot of leads here. We're beefing up the appointment setting department. We're beefing up everything it is that we're doing to make sure that Kim has brought her team here to make sure that everybody gets whatever it is that they need, that you know what the resources are, and so that we could do a deep dive. So with that, our favorite person, Kim.
Thank you. I think I've either met or spoke with everyone, but I'm Kim Scott. Just wanted to introduce our team. I'm responsible for the state of Kentucky, and I also picked up Ohio a few months ago. So I know Anthony talked a little bit about selling in other states, and I'll let him handle that portion, but the team has done a little bit of transitioning. We now have a staff vice president who's located in Georgia. That's Michael Conforti, who I report to. We've also just recently, not sure if you're aware of this or not, but we just added Chris Murray to the team. So Chris Murray is the senior director. So in between myself and Michael, so I'll be reporting directly to Chris now. And then Chris will report to Michael Conforti. Okay. And then for the state of Kentucky, my team consists of Tony Hunt, who's sitting in the back, and Melissa Minyard. They're both account executives for the state of Kentucky. And then for the state of Ohio, I have Kim Cordell Fife, who's in the back, and then Nick Poirier, who is not here today. And I think most of you have probably also spoken with Karen Bone. Karen is our sales assistant. Karen is responsible for things like giveaway supplies, stuff like that. So if you need that, Karen is kind of the glue that keeps the team together. So our intention, as Anthony mentioned, is to make sure that you all have everything that you need. We plan on supporting you. We plan on making a successful AEP, OEP, and lock-in in just future years to come. The team has tripled in size, so I am ecstatic to have help because it's just been me for several years now. So, I thank you all. Thank you for allowing us to be here. We have an awesome relationship, and anything that you need, I'm obviously there for you. I'm going to be transitioning some of the responsibility to the team, but we're looking forward to making sure that we do whatever you need to support you. So with that, I'm going to let Tony start the presentation off with what makes Kentucky different.
I do, but still, I'll go work. Okay, well, I'm Tony Hunt, and like she said, I'm gonna be working on the team with her this year. We're super excited about all the new plans, and I'll just get started. So what makes Kentucky different? This is a little bit outdated, but we have over 500,000 Medicaid members, almost 50,000 Medicare members, 70,000 Medicare PDP members, and a statewide expansion. That's something we're really excited about because we're going to be in every county in the state. Most members are going to be able to find a provider within a 10-mile radius, and in rural areas, slightly over 15 miles. We're going to go over all of these plans, our AEP and OEP for non-duals. We're going to have our WellCare no premium open PPO, our WellCare no premium HMO, which is formerly our elite plan, WellCare Give Back HMO, Essential HMO POS, and that's a plan that we had for our value members, and they've kind of transitioned into that essential plan, so we won't touch on that one too much. And we have our WellCare Patriot Give Back HMO PPO with no prescription drug plan on that one. And the WellCare Assist plan, that's for our LIS, and that's a HMO. Then we're gonna have our dual special needs plan, and that's the dual access plan HMO and the dual liberty plan. And here is our service map. Okay, our service area map and network. Our network is going to be in Louisville, University of Louisville, Norton Baptist Health System. In Lexington, we're going to have the University of Kentucky, St. Joe's, Kentucky One, and Baptist Health Systems, Frankfurt and Clark Regional. Northern Kentucky, we're gonna have St. Elizabeth, Good Samaritan, and Christ Bethesda. Bowling Green and Owensboro, we're gonna have the Medical Center, TriStar Greenview, Owensboro Health, Vanderbilt, and we're adding Graves Gilbert. Paducah and Hardin, we're gonna have Lords, Murray Callaway, Jackson Purchase, and Hardin Memorial. And Eastern Kentucky and Ashland, we're gonna have the ARA for the Appalachian Regional Healthcare and King's Daughter. Okay, on this next slide, we're just gonna skip over this because this is just our key features and we're gonna go over each one of those individually. So we'll just skip over that and go right into the WellCare No Premium HMO. Now, this one here is the one that's formerly our elite plan. So if you saw it in the past, that's our elite plan. Like I said, we're gonna be in every county, so it is available everywhere. There's no give back on this, no Part B give back. The total premium is going to be 0 on this. No deductible that you have to meet. The maximum out of pocket is going to be $5,000. Inpatient hospital care is going to be $325 copay for days 1 through 6, 0 copays for days 7 through 90. PCP visits are going to be 0, specialist 35. The over-the-counter items are going to be 115 every quarter. So you do need to use that 115 because that is not going to roll over. No medically necessary transportation. There is a health club membership included in this, which is our silver and fit. The dental benefit on this plan is going to be $1,500, and that does include dentures. The vision is $300 for eyewear. Hearing benefit is $2,000 for hearing aids, and that's going to be $1,000 per ear. The flex card on this plan is going to be $1,000. And that does include dental, vision, and hearing. But there is going to be a cap on all of these plans, only $250 for vision, and the rest can be used for dental and hearing on all the plans. No in-home support. There's going to be no deductible for the prescription drugs. The tier 1 preferred generic drugs are going to be 0, tier 2, $5, but this is just a first look, so we're going to have more details of that come the 1st of October. The lab service and x-ray services are going to be 0, and there is no SSBCI package with this. Okay, so now we're going to go on to the next slide. And this is going to be the WellCare No Premium Open PPO. So this is something new this year. There's going to be in and out of network on this, so they can go in or out of network with this plan. There is no give back on this plan. There's no plan deductible. The maximum out of pocket in network is $6,000. Combined with out of network is $10,000. Inpatient hospital acute care is $370 copay for days 1 through 5, 0 copay for days 6 through 90, and 35% coinsurance for days 1 through 90 out of network. PCP visits going to be 0 in network, 25 out of network. Specialist office is going to be $40 in network, $50 out of network. The over-the-counter items on this plan is going to be $60 every quarter. No transportation. There is going to be a health club membership included. The dental benefit is going to be $1,000, if that does include the dentures. $200 a year towards eyewear, and then $2,000 a year towards hearing aids. That's $1,000 per year. The flex card is going to be $300. And then there is a deductible on the prescription drug plan on this of $100. And then 0 on the lab services and 0 on x-rays.
So Tony, just to point out.
Yes,
On the deductible, it only applies to tiers 2 to 5. So it does not
yes,
apply.
I forgot to mention that. Thank you. Okay, now we're gonna go on to the next plan. This is our WellCare Patriot Give Back Plan. This is a plan that's great for veterans. There is no prescription drug included in this plan. So it is an open PPO as well, so they can go in network or out of network with this plan. There is a premium give back on this plan, which is $60 a month. The total, so there is 0 premium for the plan, no plan deductible. The maximum out of pocket in network is $5,500. Combined with out of network is $10,000. The inpatient hospital care is $400. Copay for days 1 through 5, 0 for days 6 through 90, and 30% co-insurance for days 1 through 90. The over-the-counter is going to be $200 every quarter. No transportation. There is going to be a health club membership. The dental benefit is going to be $1,000. That does include dentures. The vision is going to be $300. And the hearing benefit is $2,000, and that does include, that is $1,000 per year. The flex card is $500, and there's no prescription drug plan, and the lab services are going to be 0 and X-ray services 0. Now in this plan, and you're gonna see in a couple of our other plans as well, we're adding the robotic companion pet. So you get like a cat or a dog, and they're like a furry little friend, and they purr, and you can pat them, but you don't have to feed them or take them out or anything like that. And so they will get 1 per year on that. So cat or dog, and you can go on our website and look at that.
And just to jump in, I don't mean to interrupt, but
No, that's
one key thing for this particular plan. This was formerly our Patriot plan, which was an HMO. So we're transitioning it to a give back plan that's a PPO. Well, one of the things that we did find out with CMS is we couldn't map our members over. So if we really only had about 400 to 500 people on this plan, but if you do currently have a client that's on our WellCare Patriot plan, you do have to rewrite them for the new year.
Now, so that everybody on the phone doesn't get nervous.
Okay.
This is specific to this specific
specific
plan,
Patriot plan.
specifically in Kentucky,
Correct,
because most of the plans are being
mapped
mapped.
over, correct. So just so you're aware, so they would have to be rewritten to this new plan or to one of the other plans. It may not affect anyone on your team, because we only have about 500 members, but it was either do something with the plan or we,
These are all VA plans.
Yeah.
Primarily, right?
yeah, so I'm sorry, I didn't know that.
No, that's fine.
How do they
Thank
get the
you.
robotic companion?
Well, there's gonna be a number that they can call, and they're gonna, like on the back of their card, and they'll assist them on how to get that, or they can go on our website, order that with their member ID. Yeah, but they get 1 a year.
It is for people with chronic conditions, though. It's not for everybody.
Okay.
And they don't have to give it back if they switch to another plan. I've been asked that every time we've been. Okay, so this next plan, did we go on? The next plan is going to be our WellCare Assist HMO. And this is designed specifically for people with LIS. So if they're on low income subsidy, this is a great plan for them if they don't qualify for the dual eligible plan. So there is no give back on this plan. The premium says $17.50, but if they're 100% LIS, they're not gonna have this. So they say they're 25%, they're gonna prorate that to whatever that cost is gonna be for that. There's gonna be no deductible. The maximum out of pocket is going to be $5,000. $325 copay for days 1 through 6, and 0 copays for days 7 through 90. 0 on the PCP visits. Specialist $40. Over the counter items are going to be $200 every quarter, and that does not roll over. There's going to be 48 one-way trips a year, medically necessary transportation. That doesn't mean they're just going to take them there and they're not going to bring them back. They're going to take them and bring them back if they have to go to the doctor. So that's going to be included. They do have to call 3 days in advance or 72 hours. Yes.
So as far as MSP levels with the assist, we're looking at SLMB, QI, and I think it's really.
No, just LIS.
Oh,
Yes, if they're just low income subsidy, LIS, they get that extra help with the drugs. They're gonna get this.
It only applies to
Oh,
prescription.
okay.
Mhm,
So you're level 1 through 4 for the prescription drugs.
yes.
Gotcha.
Okay, and this does come with the health club membership. It's $1,500 a year for dental. That does include dentures. The vision is gonna be $300. Hearing benefit is $1,500 a year, so that's $750 per year. The flex card is going to be $750. This one is also going to have in-home support services, so chores. The chores are gonna get 2 a month, so it'd be 24 a year. And they could come in and do a little bit of light housework and whatever kind of chore they might.
Is that for people with chronic condition or that's everybody on the plan?
Well, we were looking that up. They do have to have some kind of chronic condition
Is that which one?
on the chores.
That is.
Yes, that is correct, on the chores.
So, which could be anything from, COPD, heart condition, diabetes.
Is it the same list as the SSPCIs?
Yes.
Yes.
Okay, and that deductible, of course, it says $480 deductible for tiers 2 through 5, but if they're 100% LIS, that is not gonna be in place. The lab services and x-ray services are gonna be $0. This one does have a grocery delivery and a utilities flex card. So on their flex card, each month they will be able to use $50 towards grocery delivery, which is a $35 minimum. So they have to place at least $35. So they might as well just go ahead and order their full 50. And the utilities flex card is gonna be $50 a month towards utilities. That could be used towards their water bill, electric bill, propane, cell phone, whatever utility they prefer. Okay, so the next plan is the essential plan. So that's the one that we talked about. We're just gonna skip over this plan, because that's the people that have been on the value plan. And they're just switching them over to the essential, and we've got plans with a lot better benefits than that. And now Melissa's gonna come up and do the rest.
Last but not least, we have our dual SNP plans. We have the Access and the Liberty, which did not change in names. The Access is what we're gonna cover first. The premium on the give back on the Access is $0. There is no give back on it. The premium is $0. The plan deductible is $0. The maximum out of pocket is $3,450. However, that is covered by Medicaid and Medicare. Is that correct? There is no in-hospital stay. The PCP visits is $0. The specialist visits are $0. This plan has the medically necessary transportation unlimited up to 75 miles one way. This plan does have the health club membership. This plan has a dental of $2,000 for comprehensive, including dentures. Vision is $300. Hearing is $2,000. That's $1,000 per year. We have the Visa Flex card on this at $2,000, which I think is amazing. It's incredible. We also have the chores on this one, which is 24, and you do have to have some kind of chronic condition with that, and that's like light cleaning, helping prepare meals. This plan does not have a deductible on the RX plan, the RX. The 2-tier generics they're gonna be, copays are gonna be anywhere from $1.35 to $9.85. There is no copay on the laboratory and the x-rays. And this is something that I'm really excited about this year that our plans have, is the grocery delivery at $50 on the Access. The utility flex card is at $50. And then we have our non-medical transportation for 24 per year, up to 30 miles. And we have our robotic companion pet. And there is a website that you can go to, which I'm gonna go over in just a minute.
The non-medical transportation trips, 24 trips, it's up to 30 miles. Is that just at their leisure or?
No, this is like if they need a haircut, need to go to the grocery store, need to go grocery shopping, or need to go shopping, just.
Nothing they have to fill out or anything?
Okay,
So
now,
35 miles, 35 miles,
30
miles.
miles for the non-medical. Now, the medical is 75 miles. Okay, now we have our Liberty plan. Like I said, these plans have no give back. The premium on this plan is $0. The plan deductible is $0. The maximum out of pocket is $3,450. $0 copay per in hospital stay. The PCP office visit is $0. Specialist is $0. The over-the-counter is $425 every quarter, and that's a use it or lose it. It doesn't roll over. And they can do up to 3 orders per quarter. The medically necessary transportation is unlimited. Like I said, it's up to 75 miles. And then the health club membership is included in this plan. Dental is $3,000 on this plan, comprehensive dental services, including dentures. $5,000 eyewear, or $500 eyewear, $5,000 on hearing, $1,500 on the Visa Flex card. There is chores and personal care services. The personal care services is like if they need taking a bath or moving on from room to room. And it's 24 visits per year. We have no deductible on the RX. The tier 2 generics is the same as it was on the access plan, anywhere from $1.35 to $9.85. Laboratory services is $0 and x-rays are $0. On this plan, the grocery delivery has went up to $100 per month. Non-medical transportation is $24. The robotic companion pet is included in this plan, and the Visa Flex card is going to be $100.
The utilities.
For utilities, yes. The utilities flex card, I'm sorry. Yeah, it's actually on the Visa Flex card. And then this plan is, the access plan is for the QMB, and then the Liberty plan is for QMB Plus. That's the difference. And there is an 800 number that you can call to see if they qualify for Liberty or the access plan. And then we're going to go into our vendors. We have.
She wants you to advance the slides. Gotta keep clicking.
Just click them all up there. The WEX Health is our vendor for our Visa Flex, which would Visa Flex card, which include our dental, vision, and utility. The access to care is our non-emergent transportation. Hearing Care Solutions is our hearing. Avisis is our dental and vision. The Silver and Fitness is our fitness plan, and there is a website to where you can go and check the areas in the locations in your area. And something I just found out this weekend, they actually have this. If you don't want to go to the gym, you can actually do your workout at home, and they will send you a Fitbit watch. So Joy for Life is our robotic companion pet, and you can go to joyforlife.com and you can read all about that. It's very interesting, I think. CVS is our over-the-counter, and VRI is our PRS, which is for the dual SNP only, the dual SNP plans only. Shipt is our grocery delivery. There is a minimum of $35 on the delivery. So if they're doing the $50, they need to go ahead and just use the whole $50. Do you have any questions on this?
So that's who they'll go through to order that?
Yeah,
grocery?
Shipt. It's gonna be a website. Is there gonna be an 800 number that they can call? And, okay, it's a website and an app.
So
And
I got a couple questions for you. First, on the CVS side, every state is a little different. I'm pretty confident in Kentucky, and I think probably in Ohio, it is just CVS stores.
Correct.
in Kentucky.
Okay. And the catalog ordering is for regardless of the plans?
Yes,
In New Jersey, New York, and Connecticut, certain plans you get through catalog, certain plans you get in the store. It's not CVS, it's a slew of other stores. So that this is more the majority for the country is the CVS side. For the Flex card, that says dental vision utility, that's also for hearing, is that correct?
Correct. Yeah, the flex card is vision, dental, hearing, and then, for example, if the flex card is $1,000 on the DSNP plan, and we add the additional utility of 50 or 100, they're going to reload that $50 to $100 each month that they can use towards their utility benefit. It doesn't take away from their flex card amount.
And the ship, from what I understand, is also on that same Flex card.
It is not. The ship delivery is either gonna be an app, a telephone number, but it is not an actual flex card.
Okay, got it, okay.
And I will tell you, if you go to Ship's site for Kentucky, don't be alarmed yet. They're new to Kentucky, so we're building that network. Because if you go in today, the network looks a little slim, but they will have it in place
So
by
they'll just use their ID off their medical
the
card.
question. Yes.
So on the chores and that sort of thing, who
they
does
can
that?
call the number on the back of their card. And from my understanding, do they have to have a doctor's order? Do they determine?
What they do is they set them up with a case manager to determine the qualifications. And then once they do that, then they, case manager will coordinate the chores with our vendor. We do have a vendor. I'll look at the list and tell you exactly who the vendor is before we finish.
Okay, so they would set that up for
I think it's Align Health, that's who it is. Well, the other thing for Kentucky, the hearing benefit currently is Hearing USA. So that Hearing Care Solutions is new for 2022 for the state of Kentucky. One other thing, the PERS are falling and I can't get up, automated device. For 2022, as she mentioned, it's only gonna be on the DSNP. So you may have some clients who currently have that on one of our existing plans that may see a little bit of a change with that, because that won't be available for all plans for 2022, only DSNP.
So on
Just
the
a heads up.
hearing
Both
aid, it has to go through that company right there.
I'm sorry,
Like they do hearing aids, it has to go through.
yes, it
that.
has to go through Hearing Care Solutions, and Hearing Care Solutions contracts with the audiologist.
They
Yeah,
actually
that's right.
call the number on the back of their medical card, and they will register them for the Hear Care Solutions. That's correct, that's the way they do
But
it.
then they'll set up someone local to.
Yes.
do it. Okay.
Well, first off, how's the dental network?
The dental network is actually really strong except for one location,
Right by James' house.
which is gonna be the Owensboro area. That was one of the reasons why we fought so hard to increase the flex card to overcome those areas where they might have to go out and network. So Owensboro, we have tried and tried and tried and tried. It's not just WellCare, They're not contracting with a lot of the carriers. So just transition to, well, you do have this flex card benefit that you can use in around the network if you run into a situation with a network through a visas, but it's.
One of the things that came up, which makes a lot of sense, is make sure you tell your clients to use their dental and their vision benefits first before pulling the flex card out.
Right.
Because if they have $500 in dental benefits, but they're pulling the flex card out, and a doctor that could have been in network, they've just wasted $500 by not doing it. So make sure they utilize those networks. The Joy for All robotic companion. So you guys know, this is kind of, it's kind of, it's to get people's attention. It's getting a lot of attention. It's trying to think of the proper word to use for it to describe what this actually is. What'd you say?
Tongue in cheek.
It's
You should see, go to the video.
Tchotchke,
it's what, I'm sorry, what was the word you just said?
a tchotchke.
Tchotchke. It's a tchotchke. It is. Remember those little dogs when you were a kid that used to go and used to
Oh, yeah.
flip over? It's a little bigger than that. It's about the same thing.
I think
It purs, it barks. If
Maybe
they
a
get a
photo
dog or a
later.
cat, what's that?
There may be a photo.
There was not.
Who was it?
If you keep clicking.
Maybe in the Ohio one.
No, in
No,
this
because
presentation.
it's
It's on here.
Just
It's
so
on
you
this
know it's there.
presentation.
Yeah, click through a couple slides.
I got you. If you want the video, I could share a little
Okay,
video.
We got it, Mike. So I saw one of these things at the National Welfare meeting.
They have one.
I had a bunch of them, actually, they gave them out to us.
Really?
Yeah, every room got one.
Okay.
We've been fighting for one.
Yeah, I'd love to have one.
Guys, you can go on Amazon and buy them.
Yeah, you can actually
They're
go on the
$120 on Amazon, by the
You
way.
actually go to their website and.
You go to their website,
They're-
it's,
I've got 3 real dogs.
yeah. That, again, it's a tchotchke. It's,
Right.
it's proven that people with Alzheimer's get a far way with this. It soothes them. That's the purpose of it.
And our veterans too,
And what?
veterans.
And veterans and yeah, like that type of thing. It soothes people. Are you gonna sell plans because they're getting a robotic companion? You're probably missing something if you sold the plan based on the robotic companion. But everybody always questions what this thing is. Always, it's what everybody wants to know about.
And I'm sorry, Kim, I wasn't over Ohio when we designed these
Yeah,
plans.
yeah,
Because it's
yeah,
not
yeah.
available in Ohio.
I just want you guys' attention when we get to Ohio.
We're getting hungry. I'm sorry.
Oh, no.
This,
Go ahead.
this is just some frequent asked questions. It just goes over the dual eligible for that liberty and the access. The access is the QMB, and then the liberty is the QMB plus, SLMB, and FBDE. And the chores, it talks about the chores a little bit, and then, which we already talked about. And then you also have the acute or the chronic meal benefit, post-acute, once they've been in the hospital, they can get 14 days of meals equaling 42 meals in total. The chronic meals are for members with certain chronic conditions to help them with getting them on the path to a healthier eating and wellness.
Is that every plan or is that?
This is for every plan, yes. it is. And actually in 2022, they are actually doing meal replacements. So the nutritional drinks,
Okay.
they're doing that with this as well. They can choose the meal or the shake.
Okay.
We already went over the 75 miles and then that's about it. I mean, you can. I think you
Is
skip
the
questions.
chronic conditions the same as the SSBCI chronic conditions?
Yes.
Yes,
Some plans it is.
We don't need
Alright,
to
so
go
we,
through
and that's the contact information for Melissa and Tony. The way for this year, Great job, ladies. They have actually been with me less than, 2 weeks for one and 3 weeks for the other, so.
Oh, awesome. That's awesome.
Great job.
Great job. Thank you.
So, for AEP, we're not going to split the state. They're gonna be a combined team working the entire state. Starting in OEP, I think we're gonna do a east and west thing where Tony will be on the west and Melissa will be on the east. But for now, they're your contact for the entire state.
Specific to Kentucky, does anybody have any questions on Zoom?
Yeah, just one question with that, with the flex card, with the utilities. Could somebody just clarify that for me one more time? Like how that works with the utility, with them being on the same card?
It's they use for the flex card that they get, Eric, is there's going to be money preloaded every month. Let's say they get $100 a month for the utility. There'll be $100 per month on there that they could use for their cable bill, their electric bill, their gas bill, whatever it might be. But it's preloaded on the same flex card that they're getting, that same Visa card, so that they only have to use that one number, whether it's for dental, vision, hearing, or utility.
Okay, so basically then, let's say like they have $1,000 flex card, that $1,000 is separate. The utility allotment is like a different allotment. That's what I just want to make sure I
Exactly.
understood. Gotcha.
Exactly. That's a different
Okay.
allotment. It's not a part of their total flex card.
Gotcha. So if they take 1,000 from their origin, that doesn't affect the utilities, basically.
Correct.
And vice
It does
versa.
not.
Gotcha. Okay, just want to make sure.
It's like, because don't forget, it's a use it or lose it. If they get $100 for the month for the utility and they don't use it, they don't have $200 next month. They get 100 again next month.
Right. Awesome. Thanks, Ant.
Any other questions from Zoom? Anybody here have any questions on Kentucky?
If you guys had to say, I did, you guys had to say there was, the biggest three changes as far as the elite, which is now the no premium HMO. It's not over the counter, over the counter is the same, it's not, little bit, I think it's the same, but what are those other changes?
It's actually very few changes at all. We increased, the flex card a little bit, but everything else is pretty much the
That was
same.
pretty much, so 35.
What the plans that we focused on increasing or putting the most dollars into are the DSNP. So we want to be able to grow the DSNP. We found that we were losing membership to one of our biggest competitors, Anthem. And we were trying to figure out what to do to draw it back in, hence robotic companion. So there were things that we needed to do to draw attention to those DSNP plans. We did very well in the other plans.
So on the food card and utility, that's in addition to the 1,000, right?
Correct, and remember the food is a delivery system that's not on the flex card. It's an app, they can call in, but it's not a flex card. They actually place their order and then it's delivered to their home.
So for utilities, they use a flex card.
Correct.
So we have a little experience on the ships because it was tested actually in some of the other states that was tested in Maine and in a couple other states. And a lot of times they get the food within like 2 hours. Like it's almost like a DoorDash type thing. Not always though. Depends when they call. Sometimes it might be the next day. It depends, when it is.
And remember, Kentucky has a lot of rural areas.
Well, I was just gonna say that. So the experience that we had with it in Maine is certain areas, there's a lot of participating stores. Other areas, it was so rural, people kind of shrugged their shoulders at the benefit. So I'm sure we're gonna experience the same thing here based on what area, actually not just here, everywhere in the country. Certain areas it's gonna be great in, certain areas it's not gonna be so great in, but. Any other Kentucky questions?
That was just like Texas overall LIS. This is that. The whole concept of the LIS, the DSNPs with the utility, for the people who have their utilities or low income subsidy that have their utilities paid by other factions, other entities, what about them? What happens in those cases? They still won't get it, won't use it?
No, that's just like saying on our
Give
give back plan, where their part B is paid, but will we send them a check? Absolutely not.
I mean, it would cover a cell phone bill unless they're getting that.
Right, that's a
at no
great
cost
call
to
out,
the city.
Tony. Right. Yeah.
Their cable
Cable
bill.
bill, cell phone bill, that's huge. Okay, Kim. Same upline, if you jump through, it's Kim and Nick. Again, we're not dividing the state yet, but when we do divide the state, Nick Boyer, who isn't here, Nick will have the southern portion, Columbus South, and then Kim will have Columbus North for the state of Ohio. But it's the same management. We'll have Michael and then Chris Murray, then myself, and then the 2 account executives in charge.
Okay, well, a few things. Thanks for coming. Can you guys hear me? They're out there on the Zoom call?
Yes, ma'am.
Yes.
Good. I had kids, I yell. And they still didn't listen. That's another conversation. You know, currently we have approximately 11,000 Medicare members. We really like to grow Ohio. So if you're giving consideration to Ohio, please come on over to the wild side and give us a chance. I'm listening to these Kentucky benefits and I'm like, why am I moving? You know,
Kim currently lives in Louisville.
I currently live in Louisville, but I'm moving to Ohio. That's what those kids do for you, see? So, you know, we want to grow that business. We have approximately 178,000 Medicare PDP members. I think you all know that we're transferring from the 6 plans to the 3 plans beginning in January. If you all have taken ACT, you will see how the plans are being crosswalked. So if we need more, if you have more questions about those, you know, please ask us when this is over. Our service area, we are growing the service area. We have a large expansion. Kim didn't say anything to you, but what happened was in Ohio, All Well had a great network. I mean, it was huge. The All Well benefits, not so much. So what WellCare decided to do beginning in January 2022 was increase the WellCare benefits, grow them, expand to make them more robust, and utilize the All Well network so that we would not only have a robust plan, but we would have the network that would go along with it. We're going to talk about these 5 plans. I'll be done in about 3 minutes. No, it will not take me as long. You know, 2022 will grow these, and as we continue to grow our members, we certainly hope to also, you know, increase those benefits. So you can see our service area. The elephant in the room, we have a couple. We have a great network. I will tell you right now, we're in negotiations with Cleveland Clinic. The only plan that we currently have where people can utilize the clinic is our DSNP plan. We are in negotiations, fingers, toes, legs, everything's crossed, that we will get the clinic and network before January 1. In Columbus, Ohio, Ohio State University was in network. They are now out of network, but we're currently negotiating that as well. That is looking cool, but I will tell you, I've been in this business long enough, it ain't done till it's done. Until she sings, don't give the illusion, don't say it's on its way. I've learned to be very careful. The same with ProMedica in Toledo. They have their own plan. So the only plan that we have where members can utilize ProMedica is going to be our plan, because they have their own Medicare Advantage plan, and they're hurrying up everything in Toledo. So you know, we're also in negotiations with them. But it is just that. It is just a negotiation until it's done. We'll keep you posted. If you have any questions, please feel free to This question is to Kim, because she is all things network. Kim Scott. So, you can see our service area, the ones in white are, not just a so we can go on. Our 5 plans we'll talk about, we can go to the next one. Let's see, let me make sure. This is our HMO. I just want to make sure that we're on the same one. As you can see, it's zero premium. Look at that MOOP, $3,450. It's actually the lowest MOOP that CMS will allow. So, I mean, that's great. You'll see the $275 copay, days 1 through 6, 0, 7 through 9. Check out the office visit copay for your primary care. I mean, that's awesome. A 0 copay to see your family doctor. And even if you're utilizing a specialist, if you're going to see your ENT, your OBGYN, whatever, that specialist copay is $25. We really want to ensure that our members are going and they're seeking their regular treatment. So that's one of the reasons why we are making the PCP visits copays either 0 or lower. It's much easier if you're having routine care than if you really have a problem. Over-the-counter items, $140 per quarter. Remember, use it or lose it. It might not be much, but I encourage everyone to, have members utilize that plan. I will give you a quick story. My uncle's 96. He's my great uncle. He has a plan that has this OTC, and every year we get an item for Christmas from what he collects throughout the year. And you're not allowed to change. So if you need calcium, don't ask me for my little over-the-counter diet pills, because we're not allowed to change. So, but it's a great benefit. Your toothbrushes depends. I mean, all kidding aside, we have a lot of our members who are utilizing those. They are very, very expensive. I encourage all of you to take a look, walk through CVS and look at the over-the-counters, so that when you're talking to your members, whether even on the phone, you have a list of things that are over the counter. Look for those pressure points where they say, well, I take so-and-so every month, or this vitamin. If it's over the counter, it's a great segue to say, hey, utilize that benefit. I mean, it's a great benefit. It's what it's for. 24 one-way trips every year. And the reason why they're one-way is because oftentimes one of our members may be able to get dropped off with a family member on their way to work or something like that, but they may need a ride home. So, they can make those preparations for that and go ahead and schedule that return visit home. $4,000 in comprehensive dental services, including dentures. I mean, that's a huge benefit.
As a dental network in Ohio.
We actually have Involve. It's different from Avisus. It's one of the differences between the plans. Involve is a stronger network of dentists. Come on over to the wild side, people. I'm just saying, okay? Come help me out. I'm new. I need Mama needs new shoes. So that is a great benefit. I mean, $4,000. I wish we had it as an employee. $300 eyewear limit. Hearing benefit $3,000 per year too, or $1,500 per year. That flex card, dental, vision, and hearing, please utilize it. That's a great benefit, but save it until after you've utilized your benefit for your dental, vision, and hearing in network, unless they're going to see someone out of network. And that's a decision that each individual has to make. I'm going to tell you regarding the vision, you can only utilize up to $250 of the flex card for vision. And one knucklehead ruined it for everybody. Because this person went out, got eyewear and utilized their flex card and purchased a whole bunch of glasses, and they went down to Peddler's Market and started selling them. Yeah, so hence that's the reason why for the eye benefit, you can only utilize up to $250. So, but the other ones, you can go ahead, take advantage of that flex card. The RX deductible is $75, tiers 3 through 5. Again, we utilize CVS and also Walgreens in Ohio as our preferred providers. And you'll find that out on tier 3. It's $37 for a tier 3 drug. If you're utilizing Walgreens or CVS, it's $47 for a tier 3 drug if you're going outside of those two. I mean, it's still great, but we're trying to get you into those two networks. And you can see the generics, and there's no SSBCI package on this plan. Next plan, please.
Yes.
Oh, you did? Whoops. Hey, for me, sorry about that. The WellCare Assist Plan, it's on the next page. As you can see, it's the total premium is $1,560. This is an LIS plan. It's friendly to LIS folks, but it's a non-dual plan. So you want to be careful how you utilize this plan. If they meet the criteria, that $15.60 will be waived, of course. The MOOP on this one is $4,700, and you can see the inpatient $295 per day, 1 through 7, 0, 8 through 90. PCP visits, check it out, 0. Specialist visit, $35. That's not bad at all. $100 a quarter for OTC items, and of course the 24 one-way trips. $2,000 comprehensive dental services, and then there's that $200 eyewear benefit under this plan. $2,000, $700 for a hearing benefit, 2 per year. That flex card is $500. It's not as much, but it's still something. Again, our HMO plan is a better plan, but it is helpful for somebody this plan is helpful for somebody that's LIS qualified and limited. The deductible is waived on if they're LIS on this plan, and you can see tiers 2 through 5 is 0. Tier 6 is up to $20. It's going to depend upon their LIS eligibility. Any questions?
Yes. I'm noticing that under vision benefits for both states, actually, there's eyewear limit. Is this amount limited to just like glasses and contacts? It's not going to the eye doctor?
Correct. That is the eyewear. That's actually the hardware on that. And then of course, to utilize, the package, it's the additional $250 is the max for the vision, for the eyewear on that.
Because vision co-pays for optometrists and ophthalmologists are included in the core plan.
It's going to fall under the core benefit. Any other questions? How are we doing out there on Zoom land? I think we're okay. All right, next plan, please. Thank you. This is the give back plan, a plan that keeps on giving. And let's go over here on the side. I don't want to miss anything for you guys. And this is not for the LIS folks. There is a $99 per month give back on this plan. That's $1,188 a year. So if you think about an average person, their Part B is $148.50. They're gonna get $99 back per month. Now, because it's coming back through CMS, it may take up to 90 days for them to begin receiving those premiums back. So once they catch up, they will get it all. So if it takes 90 days, they'll get 3 months of that premium, and then we'll continue. Look at the move. It's $5,500. But again, this is that give back plan. And you'll have a per stay. That's different than the per day. And you can look at the inpatient hospital per stay is $1,350. PCP visits, 0.
How many days are in a stay?
It depends on how long someone's in the hospital. It
So
could
it
be,
could be-
It's
it could
irrelevant.
be 15
It
days.
could be 1 day,
it
it's
could be-
$1,350. If it's 20 days. it's
It could be
1,350.
20, right, you never know. But I always tell people, and oftentimes this will happen, 24-hour observation can last. Some people think 24-hour observations is 24 hours, but it's not always the case. So, so if you put someone on this plan and that happens, my first question is going to be to ask them, when did they determine you were inpatient versus observation? If they went in for like an outpatient procedure, so that could vary. Specialist visits, 20%, as you can see there. And the OTC benefit is not much, but it's $35 per quarter. It's still something. And I encourage folks to take advantage of it. Medically necessary transportation is not a covered benefit. Your dental benefits, small benefits, $750 for preventative. And diagnostic services, vision, you're just gonna get that routine exam, which is still a nice benefit. Flex card is not covered, and you see the tiers on the prescription drug plan, and X-ray services is 0. But if you think about it, this is a great plan for somebody that may be a veteran, and they're not because they're utilizing the VA. And remember, VA benefits don't coordinate on the outside. And this is a nice plan to think about, for your healthy eligibles. Those ones that are only going for that routine care and things like that. So when you're doing that needs analysis, that will help you identify whether or not this may or may not be a good plan for them. Any questions on this plan? Okay. Thank you. And this one is like pardon?
Dual access.
Yeah.
It's the same.
I was gonna say, it looks familiar. This is our DSNP plan, our full duals. If you take a look, you're gonna see zeros. Look at the move, $3,450. But they are on the DSNP plan, so it's gonna be zeros on this. They are fully dual. 0 per stay for acute hospitalization. The OTC benefit, $320 per quarter. Remember, you can lose it on all our plans. It has 48 one-way trips, so it's a richer benefit. But great to have. $3,000 comprehensive dental, which includes dentures. There's that $300 eyewear limit, which they can still get gray pair glasses. Over there, $2,000 for your hearing. And but check out that flex card, $2,000. Dental and hearing. That's a huge benefit that you're able to use that card for. And then talk about the prescription benefits. You're gonna have your RX deductible is 0. And depending upon their level of LIS, it's generics are gonna be 0, brand 0. And it may vary from $1.35 to $9.85 or 15% for Tues Sept. And 0 for lab, X-ray, and there is not an SSBCI package. And question,
There is, there's a question.
pardon?
On the SSB, there's postal delivery and utilities flex card, right?
Yes.
What are the limits?
Oh, on this one, let me look. I think there's one on that one. On the HMOD step.
Pick that up. Put the cup in the garbage and the spoon in the sink.
I'll double check.
Right, okay. Now, one of the personal response system, while I'm thinking about that, let me share that with you. The only plan that the PERS system is on is going to be on our D-SNP plan. We'll come back to that question for you, Anthony. Thank you. I don't think there is one on that one.
So the only decent plan in Ohio, though, there's only one.
There's only one, yes.
Okay.
We were the forgotten
Which-
child. We're
which-
redheaded stepchildren.
James, where does that fall into your questions with SLIMB Plus, Quimby Plus? Is everybody gonna be accepted on this plan, or is this gonna be?
And that's what I was wondering about the DSNP here, the dual access in Ohio seems to just be QMB and FBDE and, or QMB plus
Plus,
FBDE
yeah,
and
yeah.
SLNB plus.
Your SLIMB Plus, your.
Yeah. It threw me off with the,
And they're, and the
Yeah,
plans are a little
it says-
different than Kentucky, so, it's almost enough to confuse. I agree.
oh, me and Patrick were asking like last year about it had a different name, the CIS plan. Okay, because the level of LIS is how you, I guess, mathematically figure out what the actual premium is gonna be. Like if they got 100% LIS, they don't have to pay the 15.
Exactly,
you know, vice
right.
versa.
Right, you're absolutely correct. And it really is going to depend upon that level. And the other thing you have to be careful for is that level could change.
Sure.
You know, and it may be, you know, for something simple, they missed an appointment, they kicked them out of the system, it's, so you have to know exactly what you're doing with it. We only want to make things better for a member. We don't want to take away a benefit. If we can't give a benefit, then
I'll create some interesting calls on SPOC with us.
we'll create some very, very interesting calls. That's for sure. And we'll go back to that. Kim was looking to make sure I did not.
I think you're correct.
I don't think there is one on there. I don't think the package is on that one.
Yeah, that actually maybe a typo on the first look.
And it could be a typo on the first look, but
So that means Assist is the only plan of the 5 plans that have the
you
SSBC.
see,
Actually, I think it is. I think it is. I think what we don't have is a robotic companion, but we have.
we don't, right,
Yeah, it's $50 on each one.
yeah, we do not have a robotic companion in Ohio at all. So no dogs or cats for us.
But the grocery and delivery is. It's $50 each.
Okay.
You two stop laughing in the back.
Great job, Kim.
And then there's, the last one is the PPO. And if you look at the PPO real quick, tell me what you see that's different.
The test for today, wake up.
It's the same 0 PCP 0.
The MOOP is different, right?
Different. And it's gonna be in your mood.
That is going to be your go-to plan if you run into someone that wants to use Cleveland Clinic, Ohio State, or Omega.
Or is traveling about the country, staying there for, 4 or 4 months and,
Well, out of state, Jen.
I wonder about our people on the border. between Ohio and Kentucky with the PPO?
That's really interesting. Because reciprocity is from Ohio to Kentucky, but not Kentucky to Ohio.
Well, not
It- and, I mean,
let me clarify that.
Well,
We had this same conversation yesterday with New Jersey and New York in the room with WellCare, all about this.
Well,
Yeah,
so for
here we go.
Kentucky, we do have, Price Hospital, we have Tri-Health, which is gonna be your Bethesda North. Simply because they're moving those satellite offices into northern Kentucky. So when we say reciprocity, whenever you check the network, you need to make sure that you're checking the Kentucky network for the, no, if you're enrolling a Kentucky person, you wanna be checking the Kentucky network and vice versa. In Cincinnati or Ohio, pretty much all the network is there, but St. E's isn't there. But why would you wanna go from Ohio to go to St. E's? I mean, there's no reason to do that, because you've got Peel Hill and all the hospitals in Cincinnati and network. But for a Kentucky person, the only hospital that's in Kentucky is St. Elizabeth. So if you don't wanna go to St. Elizabeth, you wanna go to Christ for your heart, or you wanna go to Tri-Health, you can do that if you're in Kentucky and you wanna cross over into Cincinnati. Does that make sense?
Only with the PPO,
No.
or is that what core plans do? Okay.
And this $1,000 dental, because it's the same in or out of network, essentially with the dental, you can go to any dentist you want to, basically.
Right. Yeah, the one thing, Kim, you always talk about Kentucky and Ohio, this PPO plan is unmatched. I mean, to not have, well, there's some percentages, you know, when you get into some of the core benefits, but overall, the benefits that you use on a regular basis, it's exactly the same. Look at him shaking his head. That's the same thing I did when I saw it. It's incredible.
Our benefits stand up. They stand up against all the other Ohio plans, and
It's exactly the same.
every day.
Is the gym membership benefit, is that vendor Silver and Fit, or is it Silver
Sorry,
Sneakers?
Andrew, say that again.
Yeah, is the fitness membership, is that Silver Sneakers or Silver and Fit for Ohio?
Silver and Fit.
Okay.
So there's another vendor slide when we get to it.
Everybody good on this plan? This is the go-to plan, is what it sounds like.
Yep.
So Anthony, really quick, the whole idea of the reciprocity, it's only from Ohio to Kentucky, but not Kentucky to
There's no
Ohio.
reciprocity.
No, it's,
There's no reciprocity. You have to check the network based off of the state you're writing that one.
yeah, there's certain hospital networks that
Right.
are in, I don't want to speak out of school here.
Yeah, there are certain hospital networks in the Kentucky plan that are Ohio hospitals. And that's simply because if you ever saw Cincinnati, going from Kentucky to Cincinnati is literally 2 minutes to go over the river. So some of the Ohio hospitals are building offices in northern Kentucky, building hospitals in northern Kentucky. So it made sense for us to contract with them for Kentucky. But there aren't Kentucky hospitals building satellite offices in Cincinnati, so it didn't make sense for us to contract them for Ohio.
Okay.
Makes sense, Nick? Okay. What is your feeling on people that are dual eligible? Should I finish asking the question?
You can.
Should we put dual eligible people in this plan if their doctors aren't in the network?
Only because they're gonna lose out on some benefits. Robotic companion, the,
Not in Ohio.
No,
well, we're talking Ohio, the dental is less, right? We're in Ohio. I gotta remember. I'm
yeah, but we
sorry.
can't get them in the plan anyway because the doctor's not in network.
You know, if you've got a person that's savvy enough to know that they need to balance bill or tell their doctors to balance bill.
Right.
Where I've run into issues with that is doctors saying, I'm not balance billing, or running into issues where there's a doctor that's contracted with, that's not contracted for K.
Sure.
And then they won't balance bill, and then your client's stuck with that bill. So you can.
These are people that are already going to those doctors, so those doctors are already billing Medicaid. So
I'm trying here.
Would WellCare reimburse that?
say that again.
Would WellCare reimburse any of that out-of-network stuff with a PPO plan? I mean, essentially, could someone pay for it and be like, I'm gonna submit it to WellCare though?
They'd have to take their bills down to K.
Okay.
Okay, there's two things here. Andrew, your question is, if you go out of network and the doctor doesn't want to bill WellCare, are we gonna get, can the person pay for it and get reimbursed? Is that what you're asking?
Yeah.
Yeah.
Okay.
How many of your decent people are gonna do that?
But what if they're not decent? I think he's asking
Are we
this
talking
question.
just core people?
We're talking anybody, correct?
Yeah, really anybody, really.
I get a different answer per state on this.
Okay.
So will WellCare reimburse if the doctor does not want to accept payment direct? We pay the
Yeah,
doctor.
They've got to submit the claims, to submit the appropriate claims, but yes, we should be reimbursing.
Okay. That's not the mentality across the country.
Yeah.
They need to learn how to pay claims, because we have to, as long as we have a claim that has ICP code, what's it, the code?
ICP.
Thank you, codes, we should be reimbursing. Now, is it a smooth process? Is it a quick process? Probably not. It's probably gonna take 60 days or more.
It's an exception in most states. It has to be an exception has to be made to pay that in most states. I believe that's against Medicare regulations as well, if they're saying that's that network, but it doesn't matter. That is an exception. So to hear you say that is good. Andrew, did that?
Yeah, that was good. That answered my question.
Okay. Did we kind of do this already?
Yeah, and these are the vendors. The only difference that you're gonna see between Kentucky and Ohio is Involve is used for dental and vision. And that's it. The VBI is only on the dual plan. Yeah, the rest of it is, and those are those important phone numbers like the ADL line, but you guys, you know, I don't know if you're using that, the special population lines.
RFI line. This is not, there's two RFI lines right now, one for Allwell, one for WellCare.
You said for Allwell? Right, and remember for 2022, we're going to all WellCare, so you shouldn't need the two numbers.
Okay.
Unless you have a, I mean, you shouldn't be writing anything it should only be WellCare for 2022 for the state of Kentucky.
Oh, this is gonna.
I mean, state of Ohio.
Okay,
WellCare formerly Allwell.
I get it. Okay. What else do you have? Anybody have any questions?
I have a question again. I'm sorry.
Don't apologize.
So if
The number one agent, baby, you can ask as many questions as you want.
there you go. The floor is open. Thank you. For like the Allwell, like I have an instance where somebody's in, I can't pronounce the county in Ohio.
Ashtabula, yeah.
There you go, Ashtabula. And right now, currently 2021, Allwell's the only D-SNP plan there. If I was to enroll someone in that Allwell plan, does that get mapped or switched to WellCare to the dual or no? Going 2022.
It's not in the, it's not in for 2022 in the new plans, right? Ashtabula, Ashtabula is only available in the D-SNP for 2022.
Correct.
But it's the.
But
It's the old, that's what I'm saying, it's the old plan, it's not available for the. Geez, sorry, I work better at 6 a.m. It's not available for those push plans.
Correct.
So that's zero. In Kentucky, there's a total of 18 plans. I mean, Kentucky, I keep saying Kentucky. In Ohio, there's a total of 18 plans. Okay, but we are investing in the ones that are in this presentation.
Mhm.
Those old plans are still available. So if you want to write someone in that old plan in Ashtabula, you still can. They're not going away. We're not mapping anything. They're still there. The people are still there. The plans are still there. But the benefits are not as rich as those new 5 plans.
Yep.
Is that what you're asking?
Yeah, because I was gonna see if, hey, if everything works out, I can enroll somebody and he can reap those benefits for the all well plan, and then enroll him in the better well care plan during AEP to get him started off, so he could utilize the benefits for the rest of the year and get his new year off on the right foot with the dual plan, which gives him, as you guys know, way more benefits.
Right, but not in Ashtabula. That's one of those 14, 15 counties that is not on that new plan.
I thought I saw the dual access was in that county. I'm wrong.
Yeah, it is. No, you're
It
right.
is,
Andrew.
right? Yeah.
Ashtabula,
Yep.
yep, that's in the access plan.
For the 090, is that a 0908?
What's 0908? There's, oh yeah,
I don't know that, let me double
0908.
check that. I don't know that that's accurate. I'll double check that.
What plan is that?
Look at that swap that's on my screen right there.
Andrew, at the end of the day, you still want to write the person in what it is you have right now.
Right.
If this plan becomes available, then you're gonna switch them over. If it doesn't, you're still gonna keep them in that other plan because that plan's not gonna go away.
Okay.
Yeah, this is decent. So we're on the 10.
Andrew, I may be wrong. We'll get an answer for you.
Okay, thank you.
Any other questions?
In Kentucky or Ohio, is there still the CVS Caremark mail order option for scripts?
It is the for the CVS.
Now, not OTC for prescriptions, getting them by mail, the 90
Oh, I'm
day
sorry.
mail order.
I'm sorry, for the mail order for the prescriptions. Will
We
it
still
still be-
use CVS Caremark.
Oh, there is Caremark, okay.
Yep, for both states.
Thank you.
One of the things that I wanted to throw out to you guys when we keep talking about these chronic conditions, we are talking about chronic alcohol and other drug dependence, autoimmune disorders, cancer, cardiovascular disorders, chronic heart failure, dementia, diabetes, mellitus, you know what I'm talking about, and stage liver disease, ESRD, HIV/AIDS, chronic and disabling mental health conditions, neurological disorders such as epilepsy, Huntington's, multiple sclerosis, Parkinson's, and stroke. Those are what the chronic diseases are. So high blood pressure is not one.
Where'd you get that list?
How
can we get the list?
I will post this list to WhatsApp right
And it applies to the church.
now. That would apply to anything that says SSCBI benefits, which they said that those chronic conditions are the same for the church. I'm gonna post that right now to.
And he is correct.
That's a great, I'm sorry, I don't mean to cut in. That's a great lead in to the fact that if you are not on WhatsApp, you've got to get on WhatsApp. You have to let us know. We'll send you an invite. Accept the WhatsApp invitation and you'll get all of this information that we can shoot out to you as fast as possible. If you're not on WhatsApp, please, please, please prioritize texting us or letting Anthony know, Jeff know, myself, so that we can get you in there.
Guys, we communicate so much on WhatsApp. I mean, you saw it just in the midst of the conversation. I didn't think of anything different other than let me throw it onto WhatsApp right now.
Who's not on WhatsApp?
Is there anyone here not on WhatsApp right now with us? Okay. All right, we're good here, Mike.
Okay, great.
Everyone in the room is on WhatsApp. Kim, you said that it is correct as the.
Yes, Ashtabula is in the DCS that's listed in the presentation.
So there you go. You're good to go, Andrew.
Thank you. Thank you.
But no mapped over, you have to rewrite them.
Right.
All right, cool.
Thank you.
Yeah. So October 1st, you're just gonna make. Yeah, you're just gonna make it for an RDA, for rapid disenrollment.
The DSNP plan, the SSBCI is on that plan.
Is
Yes. Yeah.
$50 each. Okay, great, great. Anything else for Kentucky and Ohio? Okay.
Kim, the contact information is on the last page. Oh, well, they have it in front of them, never mind.
Yep. Okay. So guys on Zoom, I'm gonna cut you guys off right now. So thanks for joining. Have a great day. Look forward to talking to you guys at 6:30 tomorrow night.
All right. Have a good one, guys.
Have a great day, everybody.
Bye-bye,
Great
guys.
day.
Everyone.